Okay, good afternoon. Welcome to the Thurston County Board of Health meeting for Tuesday, June 13th, 2023. It's 4:32 p.m. My name is Ty Mentor, Chair of the Board of Health. We have all of our members here, including our Vice Chair, Maria Williams, board members Beth Harvey, Lynn Nelson, Robin Vasquez, Gary Edwards, and Carolina Mejia. Calling this meeting to order, and we have a proposed agenda. Is there a motion regarding proposed agenda?
I move to approve the agenda for our meeting of June 13th, 2023.
Second.
Motion's been made and seconded to approve today's agenda. Any discussion? Hearing none, all in favor say aye.
Aye.
Any opposed? Meeting, motion passes and the agenda is approved. Item 2 for this afternoon is the opportunity for the public to address the Board of Health. And we have 4 minutes per citizen. We have speaking guidelines here. Let's just go over those quickly because I do have a couple members signed up. When you're called, please please introduce yourself, including the area of the county in which you reside. Address the board, not members of the audience or staff. Silence your cell phones. You may not donate any speaking time to another speaker. No comments that are lewd, offensive, inflammatory, hateful, defamatory, or discriminatory in nature. No outbursts of any kind. Comments that are commercial in nature, such as promotion of a for-profit business. No remarks about pending land use permits or any similar matters that could eventually become before this board or the Board of County Commissioners on appeal. Any written materials provided to the county may be considered public records, subject to public release upon request pursuant to the Public Records Act, Chapter 4256 RCW. And if you have written materials, provide them to the clerk at the end of the dais, and they'll be distributed. With that, I have first up, Terry Ballard.
Good afternoon, Commissioners. My name is Terry Ballard. I'm a 35-year veteran, 29 active. I reside in Tanglewilde and retired in 2012. I have a challenge with you. Every time it's a holiday, you quote the Open Public Meeting Act, and let me give you one for example, which is RCW 42.30.070, meaning when you have a holiday on a meeting, you're supposed to have another meeting, the exact same meeting, the next following business day. You talk the talk, but you need to walk the walk. Earlier this morning or this afternoon, we know now that you don't know how to identify racism, discrimination, reverse racism, reverse discrimination. You have no idea how to do that, and you need to seek help for that. Why I'm here today is for Senate Bill 5536. I had the prosecuting attorney stand up here and say that it's unconstitutional for him to process anybody that has illegal drugs, possession of illegal drugs, or illegal use. Well, this changed the Blair decision. Now it's a Class B, 10 years or less, 25,000 or less. Class C is a felony for 180 days or less, and 1K or less. Alternatives is referral, assessment, and services. Cannabis under 21 cannot be waived by their parents anymore. Prohibited in a public place, sale, delivery, possession, all felonies, okay? So we're looking at a program in place that the health department has nothing in place. Yet we spent $20 million, almost $20 million last Tuesday to take care of all the people that were all the 501c3s. What are they doing to take homeless off the street? 80% of the homeless, not mine, 80% of the homeless have a drug addiction. Next 4% of the homeless have a mental illness. How are we combating the mental illness? How are we combating the drug abuse? We're not. We're just paying off these 501c3s to give our homeless a hand out, not a hand up. You're not helping them. You're just supplementing their drugs. That's all you're doing. You're supplementing their cost for drugs and their living standard. That's all you're doing. You're just paying them to live. You're not paying them to combat the situation. Veteran homeless. There is no such thing as a homeless veteran. He calls the number. They clothe them. They do everything they can to get him a new job. But your health department last October came up with this great program to take 4.5K for rent, 500 for utilities. Case management was at 1.5K. Job development services for 4.5K. That these guys already have. That came out of the Veterans Fund, RC 73.08. That came out of the Veterans Fund. Veterans is an emergency fund, not for homeless. You have your own homeless fund for homeless. Why are you discriminating towards the veterans and taking money out that doesn't need to be taken out for the homeless? Taken out of the homeless instead of out of the Veterans Fund. This is illegal. It's illegal and it's wrong, morally wrong. So I ask you, how many homeless people have you taken off the street and transitioned into a real life? Answer, none. We need to get better at this, not giving these 501c3 directors $100,000 income to run a nonprofit. We need a health department, and we need the health department to do it. Thank you.
Thanks, sir. I had one other sign up said did not want to provide testimony, Mr. Doster. Okay. Anyone else in the boardroom want to give public comment that didn't have a chance to sign up? Then we can tick through Zoom if there's anyone on Zoom.
Let me call you on the Zoom screen based on the order I see you. I have Nay Seiko. I'd like to provide testimony this afternoon.
Yeah, hi, I'm a nurse practitioner student, so I'm just listening in.
Okay, thank you. Next, I have Jesse Palacios.
I'm Simon. I am just a nurse practitioner student and just listening in as well.
Right, thank you. That will conclude public testimony, Mr. Chair.
Okay. Very good, thank you. Item 3 today is a proclamation for Food Safety Week. And Sammy Berg from our public health, environmental health group. Actually, what division are you in?
Environmental health.
Okay, I thought so.
Yeah.
I didn't think there was a food specific one. Okay, environmental health, and can you give us some background on today's proposed proclamation?
Sure. And I won't repeat a lot of those stuff that's already in the proclamation because it's, but basically the bottom line is food safety is.
Sammy, bring your microphone closer.
Sorry, is this better?
Yeah.
Okay, sorry. Sammy Berg with Environmental Health. Food safety is a day-to-day issue for everyone, and one of the things that we want to highlight is that it is not just something that happens at restaurants. Everyone takes food safety into literally their own hands when they go home and make food for themselves and for their families, and our kind of marching orders for from a public health perspective for many years has been wash your hands. And so if we can send that as a message and have people do that a little better, then that would be great. Wash your hands before you eat, wash your hands before you prepare food for yourselves and others. But we're taking this opportunity to talk about food safety across the world to try to lessen the impact on our overall population and make sure that people have access to nutritious and healthy and safe food. So that'll be the comments, and then we can.
Any questions for
Any questions?
Sammy?
Okay.
No, sir.
Thank you.
Vice Chair Williams, you want to start us off with our proclamation?
Proclamation for Food Safety Day, whereas the United States declared June 7th World Food Safety Day to draw global attention to the health consequences of contaminated food and water, with this year's theme being Food Standards Saves Lives. And
whereas food safety has a direct impact on health, saves lives, and plays a vital role in reducing foodborne diseases like Listeria, E. coli, and Salmonella, and
whereas every year 600 million people fall sick because of around 200 different types of foodborne illness. The burden of such illness falls most heavily on the poor and the young. In addition, foodborne illness is responsible for 420,000 preventable deaths every year. And
whereas in Washington State in 2021, there were 29 foodborne illness outbreaks that made 339 people ill, And Center for Disease Control estimated that almost 48 million people became ill and 3,000 people die from foodborne illnesses in the United States each year. And
Whereas everyone is a risk manager because safe food preparation begins at home with 4 basic steps. Keep food and surfaces and your hands clean. Keep raw meats and other foods apart. Cook foods to the proper temperature and put food away in the refrigerator right away. And
Whereas over 1,000 permitted food establishments in Thurston County provide meals and groceries to the public every day, working in partnership with local, state, and federal food safety inspectors to provide quality food in a safe fashion. And
now therefore be it resolved, the Board of Health hereby proclaims June 7th, 2023, Food Safety Day in Thurston County and calls upon all residents, communities, government agencies, faith groups, medical facilities, elected leaders, organizations, and businesses to make food safety a priority, raise food safety awareness, and promote collaboration across sectors. Adopted this 13th day of June, 2023 by the Board.
this is the signed copy if you want to give that to anybody.
to Sammy.
I'm gonna give it to the clerk to give to the right person.
Sammy.
Okay, there you go. That's the right decision.
Thank you, Sammy.
Photo up, photo up.
No, let's not take the time. Oh, I don't care. No, I don't want to short him. No, we'll go down there. I was just trying
No
to.
pressure.
I was just trying to hurry it up.
No pressure.
We're nothing against you, Sammy.
Oh, I understand. It's been a long day already.
Okay. 1, 2, 3. Awesome.
different camera.
Wait, oh, Gary.
What happened?
You are. 1, 2, 3, smile. Thanks. Get yourself in trouble.
You wouldn't expect it in that class.
Okay, department item number 4A is an update on permitting options for temporary food establishments that propose to operate year-round at multiple venues without connection to a public event, which is a term of art. And Sammy, you're going to, you're welcome back, and you're going to give us an update on where we got with the
Thank you.
meeting that we had.
Sure.
last
And
health meeting.
you're hearing me out right now?
Yeah, yeah.
Okay. Thank you. So as an update, we had meetings with the board back in February and March about how we can possibly create a pathway for food vendors that kind of fit in the cracks of our permit structure. And we're trying to see if they could do what they wanted to do, and we could figure out a way to, in a regulatory fashion, make that work. And we had lots of good conversations with the vendors and in particular the tap room owners that were trying to get food vendors to meet their needs, and had good conversations, and we ended up being able to make that work. So the update basically is that we'd come forward with a process to have them apply to become basically mobile food units, and then using our local process for a variance to make specific requirements, but also give some lenience from other requirements that would normally go with a food truck, and basically the absence of a truck, and allowing them to be able to operate with canopies and in a kind of a more limited fashion, and then trading off a kind of a reduced and controlled menu for the kind of lesser equipment that they were bringing to the table. And we were able to put that together. We had a really good listening session back in April with those folks, as well as some of the board members. And one of the main things that came out of that conversation was to work with them to we had originally proposed to require refrigeration, mechanical, plug-in refrigerators and plug-in hand wash sinks. And we've since figured out that we can make it work in a safe fashion with the same equipment that they would normally bring to a temporary event, the fairs and festival style, with coolers and ice and whatnot. Again, trading off effective, solutions without necessarily bringing in a lot of infrastructure. So what we are planning to do is later this week, we will send to the vendors that are interested the application packet, and they'll apply for these permits as a mobile unit. And in the meanwhile, while we're going through those review processes, we will allow them to continue to operate under their temporary permit until probably in around September, when we'll have everything finished up and get them going as fully permitted mobile units. So from their perspective, they're going to apply and kind of tell us how they're going to make everything work, and we'll review all that. They'll work with approved commissary kitchens and approved menus. So, and then they'll be able to do what they were looking to do, is fill that niche between what mobile units can do and what temporary folks can do with public events. So we've trying to think if that's been pretty much the update. The main comments back received from the vendors was, again, the issues around and concerns around the equipment, and we've made some changes to that and made that an easier entry point for their businesses. But we're still expecting, professional service, professional quality, training, and interaction with us to make sure that we're all on the same page about food safety. And we think this will be successful, and we'll continue, of course, to work with the vendors and the taproom owners and, of course, you all to monitor how this goes forward and make any changes we need to. But it should be a fairly smooth process, so we're looking forward to that. Are there any particular questions or?
Go ahead, Commissioner.
Board Member Edwards.
Under your initial requirements for the mobile food unit application, $750 fee, and then submit a variance request, that's a $425 fee. And so that's well over 1,000 then? I mean, the 425 doesn't come out of the 750?
Correct. So what we were doing for the folks that participated in this pilot program that we've been in almost a year now, because we've done a lot of that review already, we were not going to charge those particular vendors that variance fee because we felt that was a fair exchange for the work we've already put into their review. But the mobile unit application fee is $750. The way we make that work is that if they submit, in particular, a thorough and well put together application, it generally doesn't take that full amount, and any monies left over from that review process get rolled over towards their permit. So, we try to make sure that there's good value to that price.
I guess, I don't know, from my perspective, if it ends up costing $750 and $425, boy, that seems excessive, but I don't know how anybody else feels about it.
Well, for comparisons, just for a multiple permit to do multiple temporary events for the year is about $500, just for comparison purposes. The multiple temporary permits and the code requirements around that limit operators to only 3 days a week or less. This would allow them to operate 7 days a week or more. Well, I guess it's hard to do more than 7 days a week, but it'll allow them to operate as many days as they'd like to. And so there's some of the compromise and the value of being able to go with that mobile application.
What would it take for us to affect that permit?
At this point, this is one of the reasons why we were proposing this, is that everything is in place right now. We have the variance process already. We have a mobile unit permit already. So mainly we're just letting you all know of the progress that we're making and giving you an update on that. But that's why on Thursday, we're ready to just roll this out and get this moving.
Board Member Vasquez,
Pardon?
are you good?
Yes, sir.
Board Member Vasquez.
Sammy, in previous presentations, I feel like I remember you presenting some of the comparable costs to actually starting a food truck.
Correct.
Which is like the next step up.
Right.
Right, and that is much more expensive, right, due to not only the investment in the truck, but also some of the other costs involved.
Yeah, generally a food truck in and of itself is around $70,000. So this is still definitely a relatively low entry point into this. And for most people, it is a stepping stone. Working under a canopy works great for the nice breezy 70-degree day, but too hot, too cold, too windy, too rainy, and that all it makes for a challenge. And so most of the vendors we talked to were liking this as a potential stepping stone to either a brick and mortar facility or basically gathering the resources to move up to that next level.
Thank you.
Yeah.
Any questions on this one? No? Board Member Mejia.
I don't really have a question. I guess I just kind of want to give some, not feedback, but just some comments to the Board of Health. After the first proposal kind of went out, I think a lot of the tap rooms and as well as the pop-up operations reached out to a lot of the three of us, both Commissioner Edwards, Commissioner Menser, and just because we were the previous Board of Health. So they had our numbers. And so they reached out and there were a lot of comments. We set up a meeting with Sammy as well as David, and both newer operations that were thinking about going into this program as well as the existing ones, as well as some that were now kind of phasing out of it. There was one that was going more into the catering side of that business, but they started out as a pop-up. And the tap room owners as well, they came in and they provided feedback on just how this program, the pilot program helped, how the new program could provide some obstacles for both people thinking into going into pop-up program and as well as the tap rooms. I mean, there is an economic impact to the tap rooms. A lot of the tap rooms do not have food service, and so they're, they kind of partnered up with pop-up models to provide that food in their breweries. And so I'm happy. I know that with this new model, and I believe that you're going to be setting up a meeting with that same group and kind of walking them through that same program.
So yeah, not necessarily a meeting, but we have a lot of information for both the taproom owners as well as the vendors to help them understand the same process. And we'll be pushing that out come Thursday. Basically, we're going to give them 30 days to go through the materials and submit that application, because we would like to. The pilot program has some challenges because it's kind of a gray, messy area that we provided some flexibility, and we're wanting to really understand, okay, because that was part of the feedback we also received, that there was some confusion about who was in the program or who wasn't, and we're trying to make that really clear about, so if you want to apply, then get that in by mid-July, and we'll go ahead and get you processed. For vendors who choose not to, all the other options still exist. If they want to do all the public events that are going to go on, and we have pretty much multiple events every weekend between now and the end of the summer. So if they excuse me, want to do that as a business model, they can. There's nothing to prevent them from doing that. Excuse me. But this was the kind of the doorway to getting reviewed as this mobile food unit with a variance. And again, partly just to be real clear about who wants to go down that road and who doesn't, and then also provide some efficiency around trying to handle those, at least that initial group of applications. There's no problem with someone later down the year deciding they want to go into that program. That's, so that door is wide open. We're just trying to handle this initial group of vendors in a pretty streamlined fashion so we can get them going as we then, and then that program will just sit and be available for anyone else that wants to come down the road for that.
Jenica Machado, our economic development program manager, also attended that meeting because she said that, I know they were working with the Economic Development Council. They had a couple of other people interested in the program and seeing if this was an option that fit for them. So I'm wondering, has there been coordination with them as well as?
I've talked to Jenica, and I'll be happy to provide the same materials to her to be able to share with other people. And we will be putting up something on our website to kind of, again, explain to whoever comes down the road afterwards about this is how this works and this is what you can expect. So.
I realize that you're trying to offset the expense to the taxpayer by having these fees. That's my understanding, right?
Correct.
So do you have any type of assessment of fine when you go out to a food establishment or one of these folks and they're in violation? They got a couple of reds and 10 blues or whatever. I look at your stuff in the paper once in a while. And I mean, that's pretty detrimental to the business to be listed in there. So that's kind of a punishment in itself. But we don't do the same thing on school zones. We try to protect kids. So I don't know, it could be an article in the paper, Joe Smith got a ticket for speeding in the school zone, but he might have also had to pay a $200 fine. I'm just wondering, is there anything like that in your enforcement activity where those that are in violation, and I'd want to have it be serious violations, but where they would pay a fee as a fine type of a thing, and maybe that would help offset some of your expenses?
There is. We have what we call a reinspection fee. So if you exceed 45 red points, or if you have repeat problems, we basically say we have to come back in a week or so and make sure that these problems got fixed and stay fixed. And as part of that, then we charge a $250 fee.
Oh, okay.
We, again, trying to balance out between not necessarily trying to make it overly punitive, because the main point is just to, again, recover that staff time to having to go out and verify that things are better. But also provide a little bit of a stick to say, let's please get this addressed or we'll have to come out again, So it's a kind of a balance point for that. But yes, there is a financial penalty for having problems like that.
Thank you.
Yeah.
Director Bain, see your hand.
Yeah, it's weird not being in the room. Thanks for this.
Sorry about
And
that.
No, it's all good. And thanks for Sammy for the presentation. I just wanted first to give a quick thank you to the Board of Commissioners for the work you did and kind of getting this process moving for us, particularly Commissioner Mejia. I thought the meeting we had back in April with the vendors and the breweries was really productive, and you can see like the direct results of that meeting kind of helped us kind of reshape and think how we want to do this policy. So it's an example of kind of how I want us to continue to work as a department, which is to, of course, always maintain our highest standards of safety and health for the population, and also listening and hearing from the community, right, and what they need and what works for them as well. So I wanted to also highlight really quickly the point you made, Commissioner Mejia, about working with Jenica, and it's my intent that we are intentional about how we advertise this new policy, so that folks are aware of it. So my hope is to work with not just with her, but with the Chamber of Commerce, working with our PIO internally and figuring out the ways that we can spread the message here so folks are aware of this. And I think if I remember correctly, we're one of the first jurisdictions to do this in the country. I know on the West Coast, we're fairly unique. And so I think this is something we can be proud of as a jurisdiction that we got this pulled off. So just want a shout out to folks on this one.
All right, Environmental Health Division Director, Art Starry, in his last appearance. See your hand, Art. You're up.
No, well, thank you. Yeah, I just wanted to just acknowledge, I think the work that Sammy did along with working with David and having the meeting with the vendors and the taproom folks, because I think having that meeting, we realized that the structure that we came up with wasn't going to fit exactly what their needs were, which is they tend to operate for just a few hours. And when we realized that, I think that allowed Sammy to work with staff then to fine tune the program to recognize the mechanical refrigeration and the other stuff really wasn't necessary for that. We could still have safe operations operating within those constructs. And most of the time, those operations are less than 4 hours. We didn't establish an hour limit in this proposal because there's not that many we don't think that will extend beyond that. But we wanted, I guess that was I think a fine, I mean, something important that we realized as part of that outreach process. So that's why that came about. And then getting a little bit to Commissioner Edwards' question about some of the fees and things, we're trying to make this work within the rules that we have. And that requires that variance, which requires an additional review, which there's a fee with it, of course. In a perfect world, we might be able to revise our food regulations to be able to address this more directly, but that's a long process, and we wanted to have something that could happen soon. And so that's why the process is that it is what it is what Sammy worked with the State Department of Health and others to kind of put this together so it could fit within our existing rules. It could be done administratively. It doesn't require a rule revision. So that was a really important point and something we wanted to try to do if possible. So that's a little bit of background information there. So that's that.
Is this an open application or a closed application? I heard you say something about July.
So it's open essentially. We were wanting to provide for the folks, there's say a half dozen folks that are part of the pilot program right now. We wanted to provide them a clear window as to when to apply, and then allow them to transition and continue to operate the way they are until we get to final approval, which will again be towards the end of the summer. But we wanted to make that a kind of a clear gate to go through. So the folks that weren't ready to go that way or had different plans, that we were again very clear about who's in or who's out. But anytime someone else can come in and apply, just they would have to wait until they get to approval before they could start operating in that fashion.
Gotcha. Thank you.
Anything else on this item? I failed to point out earlier, our county health officer, Dr. Abdulmalik, is on Zoom. And Dr. Abdulmalik, just put your hand, you're welcome to pipe in on any topic. Just put your hand up and I'll get you in there. Okay, thank you, Sammy.
Okay, thank you.
Item 5 is Thurston County Medical Reserve Corps Annual Report. We have a whole bunch of guests. Sue Pointer, welcome.
Thank you. It is absolutely my honor and pleasure to introduce the rest of our staff that is going to do this. But I wanted to take a minute about the MRC. We're celebrating our 20th year this year, and we're going to go into a few more historical facts, and our staff is going to share that with you. But I wanted to share a little bit about what it takes behind the scenes to run a pure volunteer program that takes a lot of vetting, et cetera. And one of the components with that is staff. And as our director, David Bain, said to me, EPR, Emergency Preparedness and Response, and we love acronyms in our work world, is a small but mighty team. So first off, I want to introduce you to our team. I'm the Emergency Preparedness Manager. Daphne Devlin is our emergency coordinator and runs the MRC program. And I want to introduce you a new staff. We have got to hire an additional emergency preparedness coordinator, Donald Cease. And Don comes to us wonderfully we stole him from the prosecuting attorney's office. So they both bring some skill set, but there's so much work that goes behind the scenes. First off is having good quality staff and a commitment to staff. I think the second thing is a commitment for leadership. What has MRC sitting at 20 years in Thurston County is the leaders and the staff that have gone before any of us that have made that commitment that this was a program they wanted to continue. And it's been incredible program. It takes a lot of behind the scenes vetting as well as organizing and planning. I would never, if I hired any of you, ask you to supervise 105 people and make sure they got their training done every single year and they came out and at least showed up 2 or 3 times to work. But we do that, and I want to share that. The other third component is partnerships. So public health, our ability to outward focusing and partner with community members, especially Thurston County Emergency Management. There's a component that we're tied together with them for Medical Reserve Corps that provides that liability insurance. It's not an L&I coverage for our volunteers. And it's just a really incredible program to be a part of. And again, it's been an honor and a pleasure. With that, I don't know if you have anything to say, Don, while you have up here. It's your opportunity. We hope to get Don back out to share with you in the next little bit, to share some of the work he's doing on mass violence project we're doing with Prosecuting Attorney's Office. That's not why we stole him, but I don't know if you want to say a couple.
Nope, I'm just happy to be here, and hopefully I can bring something new, and I'm gonna go sit down.
And I'm gonna let Daphne take it away.
Okay. Good afternoon, board members. Again, my name is Daphne Devlin. I'm an emergency preparedness and response coordinator on Sue's team, and I'm also the unit coordinator for the Thurston County Medical Reserve Corps. And beyond our EPR team, we also have several members of our MRC leadership team with us here that are going to present a little bit later. And we also have several members of our general membership. So we're really happy to have them here supporting us and getting the opportunity to share to the expanded board more about the Medical Reserve Corps and everything that we're doing. So actually, if you want to go back one slide. Thank you very much. Okay, so the Medical Reserve Corps is a community-based volunteer program that strengthens and expands the local public health system's response efforts during health emergencies or disasters. Members include medical and non-medical professionals who contribute their unique skills and expertise to prepare and respond to health emergencies. A little bit of history. Following 9/11, thousands of people showed up to volunteer, but there was no way to ID or credential them. There was no liability coverage. There was no standard trainings, and there was no volunteer coordination. So there was really a gap there in volunteer response coordination. So in 2002, the National MRC program was started. Currently, there are over 800 units nationwide with over 300,000 volunteers. Our MRC units, again, bolster local public health and emergency response infrastructures by providing supplemental personnel as surge capacity to help enable communities to meet these specific health needs. All of our volunteers are pre-vetted and trained, so assistance in an emergency can be provided quickly and easily. And our MRC volunteers train throughout the year to improve their skills, knowledge, and abilities. Often we partner and assist with community events and activities which allow us to practice our deployment as well as our skills. And again, MRC units provide community members the opportunity to offer their skills and time to make their communities healthier and safer. You'll see the mission of the National MRC. It's to allow local public health professionals and others to voluntarily contribute their skills and expertise to provide public health surge capacity. Next slide. Thank you. The Thurston County MRC unit was started in 2003 under then Director Sherry McDonald and Health Officer Dr. Diana Yu, who is still currently a member of MRC, and she's actually a part of our leadership team as well. She couldn't be here this evening though. Thurston County MRC was one of the first units in Washington State after the call to serve after the 9/11 disaster. As Sue mentioned, we will be celebrating our 20th anniversary in September, actually. So we're very proud of that. Since then, there have been many people and partners who have supported and maintained the readiness of this volunteer unit. And all of these efforts have put us in the position we are today with a ready, trained group of medical providers and a variety of other professionals who are ready to serve the community in the event of a public health emergency. Thurston County MRC currently has 105 active members, with 70% of those being medical professionals and 30% being non-medical. Our medical volunteers are active and retired physicians, nurses, pharmacists, and those who are medically licensed. Some examples of our non-medical volunteers include administrative, translations, mental health, logistics, and other professionals. While our name is the Medical Reserve Corps, it takes a variety of skilled professionals to assist in all of our events, as well as assist in response. So you don't need to be a medical professional. Volunteers for the MRC can include greeting clients, attendees, looking up records, traffic monitoring and control, and all the way to administering vaccines. So we need a variety of both non-medical and medical volunteers. A big part of the Medical Reserve Corps is our annual events and trainings, which in addition to building relationships with our community members and partnerships, they also help to train and prepare our MRC for response to help public health emergencies. Our trainings help prepare our MRC for a variety of response activities, including medical screening, vaccination, disease investigation, point of dispensing, and medical countermeasures. A lot of those might sound familiar after the COVID response because our MRC was heavily involved in that, and we've been preparing for that for nearly 20 years. Through our MRC activities, we collaborate with a wide variety of community partners, which help build and maintain critical relationships. Community collaboration and partnerships are essential to emergency preparedness and response and help to ensure that our MRC can provide support to our healthcare system and those activities needed. Some examples of our partnerships include local school districts, local hospitals, the Nisqually and Chehalis tribes, local healthcare providers such as CMAR, Valley View, and community organizations such as Together and the Washington State Senior Games. We have a very active leadership team that meets quarterly with our health officer, and this team assists in collaborating in event planning and ideas for events, improvement items, and they each provide expertise in their respective fields. Today we have 5 members of our leadership team who are present, and they're going to be sharing a little bit more about their experiences in just a few moments. Next slide, please. Thurston County MRC contributed a total of 1,278 volunteer hours in 2022, representing an economic value of $89,182 to the community. 560 of those hours were directly to the COVID-19 response, supporting vaccination and testing efforts for both the Thurston County Public Health and the Nisqually Tribe. Other activities outside of the COVID-19 response include some of our traditional preparedness and training events. 463 hours were training and planning, including our quarterly leadership team meetings, planning sessions, vaccinator and screener trainings, CPR first aid certifications, and orientations. 210 hours were contributed to community events, including back-to-school immunization clinics for students ages 3 to 18 who are entering school, and 2 first aid stations at community events. 44 hours were contributed to other response activities. This year, we did deploy down to our neighboring county, down to Lewis County, during their Goat Walks wildfire. Lewis County does not currently have a Medical Reserve Corps, so we have partnered with them in the past and continue to do so to help support when they have surge needs. And next slide, please. Okay, so on the screen, you'll see some of the activities and events that we supported during 2022. There's a distinct difference between events and response for MRC. Each event that MRC participates in is planned, and it's used as a training for identified response capabilities. So for example, our back to school clinics are a pod or point of dispensing exercise. So we are training for basically mass vaccination. So we were able to use those years and years of back to school IMS experience to directly use that training during the COVID response with setting up our mass vaccination clinics. The purpose of all of our events is twofold. Again, both to train for emergency response and also to provide a service to the community. So you'll see that with each of our events that we're participating in, we are both training and we're also providing a service to the community. So now I would like to call up our leadership team members individually, and they are going to give some information about their experiences with these events and what MRC means to them. So Lucy, I'd like to introduce you.
Hello, my name is Lucy Kegley. I'm a registered nurse. I'm the chairperson of the Medical Reserve Corps leadership team, and I've been a member of the MRC for 3 years. One of the events that I've enjoyed being a part of through the MRC is the back to school clinics that we do every summer. Since 2015, Thurston County Public Health and Thurston County MRC have partnered with local school districts and community organizations to offer no-cost immunization clinics for school-aged children prior to the start of school. These clinics offer the 6 school-required and 2 recommended immunizations at no cost through the Department of Health Vaccine for Children program. These annual point of dispensing operations allow the MRC volunteers to practice administration of vaccines en masse in preparation for deployments that may occur, such as COVID-19, like Daphne just mentioned. MRC roles at these clinics include administrative activities, medical screeners, and vaccinators. It takes about 20 volunteers at each one of these back-to-school clinics to make them a success. 4 back-to-school clinics were held in 2022, with 136 students receiving 325 vaccines. We also partnered with the COVID-19 team to offer the COVID vaccinations on site. So it really feels good to be able to provide this service to our community. Kids can't go to school unless they're fully vaccinated. So it's really a nice thing to be a part of. I wanted to mention too that we partner with the Nisqually tribe. We partner with them, and since 2018, the MRC has assisted the Nisqually Tribal Health Care Center in their annual one-day flu immunization clinic. They're really well organized. They have a lot of great infrastructure. They just need the personnel to come in and help get them people vaccinated. So it's a nice thing to be. MRC roles at this clinic include medical screeners, vaccinators, and flow monitors. In 2022, the MRC assisted in the administration of 132 flu vaccines at the Nisqually tribe. I joined the MRC in 2020. I wanted to be a part of the solution to the COVID-19 pandemic. But I found so many more opportunities to serve my community through this organization since then. The MRC membership stands trained and ready to deploy when a public health need arises. This can take many forms, from giving families an accessible place to have their children immunized, to deployments in a community health crisis. It's an honor to serve the community through the MRC. Thank you.
Thank you, Lucy.
And next up is the Vice Chair, Ann Monahan.
Hello there.
Down to bring the microphone.
Yes, I'm a little on the short side. Sorry about that. I'll make up for it. My name is Dolores Ann Monahan. I go by Ann. And I have been an RN for 49 years and have loved every year of it. And I retired right before COVID. I joined the MRC right before COVID. And it was a wonderful, the timing for me was great that I had already onboarded when COVID came about. Having been just recently retired, I was the inpatient nursing director at Providence St. Peter, and it was so hard for me to sit on the sidelines when I knew that my colleagues, those that I had trained so many of and hired through the years, struggling. And so to be able to work through the Medical Reserve Corps was a way for me to be involved so that I wasn't sitting on the sidelines. And when the vaccines became available, we were so ready to go to get our most vulnerable populations vaccinated, which were our seniors and our healthcare providers. And I have been now with the MRC for 3.5 years. 2 of those years I have been on the leadership team, and about 1.5 years I've been the co-chair with Lucy, I co-lead with Lucy as our lead. It's a wonderful group of people to associate with and to work with. Some of the things that I've been involved in early on was all the COVID, things within the COVID project, from the tracing to doing follow-up with people, calling them on the phone, giving them their results, people were at that point, you would have to scrape them off the ceiling to get them to come down to be able to hear and understand what was going on and what they needed to do. Did COVID testing, and also I can't tell you how many vaccination clinics that I worked in and my colleagues. And when we would go all day, sometimes nonstop, running in. We did a lot of mass vaccination clinics at the fairground and at the college. And it was an unbelievable time. I really thought in my career that I had seen just about everything, and then COVID. And so it was really a busy time, and a time that I was so happy to be able to help. Other things that I've been involved in has been doing some of the trainings for the MRC, and also I wanted to talk about one of the activities, one of the events, and that's the senior games. And it was my first year to do that. I actually got to do the STP, but Britt's going to talk about that. He trained me. He's an excellent trainer, and I loved it. And so then I went on to the senior games, and it was a little bit calmer than the STP. One of the things I want to point out is something that Daphne and Lucy said, is that we run every one of these events like it is a disaster. And I say that because we follow the FEMA program. So whenever you arrive, you sign in. That way we know where you are. And then we report to whoever is in charge. And we do a debrief. Also, we do any just-in-time training that needs to be done before we start working. And one of the things that I learned is go through your supplies. Know what you have to work with. Whether it's a deployment because of a disaster, or it is doing an event for our community. Some of the things we did at the senior games was we treated 27 people, and we gave out over-the-counter supplies as well. And we had one serious injury that day, and we were at our tent when they announced over the intercom that we need the Medical Reserve Corps first aid now at the 100-yard line. And we strapped on our packs and across the field we went. And I think we were running as fast as the runners that were on the track to get to our victim, who had a serious condition, and we ended up sending him to the emergency room via private car. So it's those kinds of things in our community that we support. And one of the questions is, why did I join the MRC? I get more out of it, I think, than my recipients do. And I talked already about COVID and that experience, which for me was, it gave me an avenue to help instead of standing on the sidelines. Thank you. Oh, Britt. This is Britt.
I'm Dr. Britt Smith. I'm a retired family practice physician. I've been here as a physician for 30 years. I've been with COVID for 20 years. Dr. Yu and I were, Dr. Yu and, huh?
MRC.
That too. Dr. Yu and I were medical students together at the University of Washington. And when I got to town here, we reconnected. And when she decided that we needed to have an MRC in this community, she called me. And we were able to put together I think, a wonderful organization. I get to talk today about STP. That stands for the Seattle to Portland Bike Ride. It's a fun ride. 10,000 people are involved in this, and they go through the southern part of our county. And we set up a first aid station in the Tenino City Park. If you know where that is, wonderful. It's where the Quarry swimming pool is. They've got a museum down there for trains. It's a very nice community. And when 10,000 people ride through there, you know there's going to be trouble. 10,000 people who are big athletes are going to try to go through there as fast as they can. And when you have a traffic jam there, people are going to fall down and hurt themselves. And over the years, we have seen some reasonably serious injuries. Part of our psychological training helps us convince a rider who has cracked his skull, broken his helmet, that he needs to not ride any further and get in an ambulance because, I mean, these are trained athletes. They're going to go on if they can. No, you should stop here and get in the ambulance, where we partner at that point with the Tenino Fire Department and their aid station. So that's our partner while we're there. We also do a lot of bandaging. We do a lot of bee sting care. For whatever reason, the bees love the riders as they zip through and they decide they're either going to hit them in the face or go down their throat. This can be an emergency. This is triage training. Another part of our first aid training is to say, yes, you need to have these things performed. You should not ride further, or we can do this for you, and you can ride to Centralia, which is where the next medical station is. This is a wonderful event. It's good that we can help them and represent Thurston County, which is part of why we're there, is we want them to think Thurston County is a good place to ride through. I joined MRC not only because my friend asked me to, but because this is where I can serve the community that I grew up in. I grew up right over here off of College Street in Lacey, and I'm a Thurston grad. So I'm a local person. It helps to be able to serve your community when you finally become an adult. Do you have any questions about STP? Great.
Thanks, Brett.
Next speaker, Dr. Dan Paul.
Hello, I'm Daniel Paul. I'm a retired surgeon. I moved to Olympia in 2020 from Seattle to be close to grandchildren. And not long after that, my elder sister died of COVID-19. And in April of 2021, I joined Thurston County MRC, intending to participate in the fight against the pandemic. And I've had an extremely gratifying experience working in MRC, particularly conducting COVID-19 vaccinations. I worked a lot at the South Puget Sound Community College, at the Thurston County Fairgrounds, multiple churches, a mosque, multiple schools, multiple mobile clinics, and at the Thurston County Corrections Facility. That sounds like a lot, and it was a lot, but I assure you the 800 or so patients whom I vaccinated do not constitute a record number for an MRC volunteer. I joined the MRC seeing it as a venue for worthwhile, interesting medical volunteer activity, and to take positive action against this pandemic, which had basically confined us all to house arrest for quite a while. The clinic experiences that I had, the vaccination clinic experiences that I had, have provided me with many extraordinary memories. Old women crying because they had just crossed something they needed to do to start visiting their children and their grandchildren again. Patient mothers dealing with difficult children who are about to be vaccinated. devoted family members attending to completely incapacitated relatives to get them vaccinated. And that all sounds pretty intense, and it was. In many ways, it was like the organization, it was like a paramilitary exercise, in the good sense of the word. The big clinics at the South Puget Sound Community College and at the Thurston County Fairgrounds, however, they were like rolling parties. I mean, people were high-fiving and cheering, and there was music a lot of times. There was a lot of very serious stuff going on in the background, making sure the processes were being attended to properly. I was very impressed with what a complex operation it was, the whole thing, put together this program of vaccination for the county and surrounding communities. I vaccinated people from as far away as Marysville. And there were a lot of people have put in a lot of effort and time and capability, both from Thurston County Medical Reserve Corps and from Thurston County Public Health and Social Services. Now, I've been asked to comment on the value of my activities or the activities of MRC. I think the vaccination of tens of thousands of people, I mean, the value of that speaks for itself. But I would like to add that this will does serve for sure as valuable preparation for the next pandemic, and there will be another pandemic, and it may be worse, possibly much worse. And there will be other public health crises, public health threats, in which MRC may play a very important role. It's been an honor to participate already as a member of MRC, and I look forward to my time as a member at large of the leadership team. Thank you.
Thanks, sir.
Hi, my name is Carrie Nicholas. I am I've been a member of the MRC since 2012, and I've been a member of the leadership team since last year. I'm a member at large in the leadership team. So I'm going to talk to you today a little bit about the response that Daphne mentioned, the Goat Rocks fire, which was much less complicated than the COVID response, but definitely needed. We responded to the Goat Rocks fire in Lewis County on the request of Lewis County. And there were 3 of us who deployed. It was a total of about 44 person hours. Some of them stayed overnight. I was there probably most of the day. And we went primarily for psychological support. So my background is in psychology and epidemiology. Unlike these lucky people, I am not yet retired. But I was able to go to that response over the weekend, and it was very traumatic for a lot of the people. As you can imagine, most of the people who were able to get out were able to go stay with friends and family in Seattle and things like that. So the people who stayed were really pretty vulnerable. A lot of them were worried about their family, their houses, their animals. Makes me a little, there was one lady who was really worried about her horse, you know, so we spent a lot of time just talking with them and making sure that they had the right kind of support once we left too. That was really important. And I'm going to look at my notes here, sorry. So one of the reasons that I joined the MRC was really to understand community needs during disasters and during pandemics and all of these things that we deal with on a regular basis. Because my job, I worked for community health centers for many years, and now I work to write guidelines for healthcare. And so a lot of my experience, I bring back information that isn't really readily available to people who aren't out in the community. And I think that's the real value of the MRC, is that we get to talk to the community and be there in that moment that they have struggles. So yeah, thank you all very much.
Okay, I would just like to say thank you to our leadership team members for presenting on those activities and the impact of MRC. Obviously, that's only 5 of our 105 MRC in our unit, so you can tell that this is a very active and very impactful group. Yeah, perfect. I just wanted to wrap things up. We have a lot of upcoming events. The summer is our busy time for MRC. We have several community events, the STP is coming up, Washington State Senior Games, our back to school immunization clinics. We'd like to extend an invite to the Board of Health. If any of you would like to come out and visit these events and see what we do, please contact me. You can contact me there at my phone number or the MRC email address on there. We'd love to have you out to see what we do. If we'd like to throw this out there to the community as well. We are continually recruiting to continue and further build and develop our MRC unit. So if anybody is interested, or if you know of anybody who might be interested in joining our MRC unit, both medical and non-medical, you can go ahead and go to waserve.org, or again, email the MRC at co.thurston.wa.us to get an application. I'd like to thank again our leadership team and also our MRC members who are our general membership who are attending today in support, and thank the Board of Health and also public health leadership for supporting Thurston County MRC. Thank you all. Oh, questions? Sorry.
Yeah, we got comments.
Yes.
Start with Board Member Harvey.
Just as a member of the community that dealt with COVID, I would personally love to thank you for all of those extra vaccines that you helped do so that it allowed us to do that plus take care of people. And it was outstanding. And the feedback we got from our patients was wonderful. And they felt really cared for and they felt really safe. So as a person who also did those mass clinics, trying to just get in as many as we could at a time, we really appreciated that buffer that you gave us and the expertise that you provided, and I'll be forever grateful.
Thank you. This question's for Sue, so if you can kind of come up. Seeing this program, and unfortunately, it's like you don't hear about just the great work until something bad happens, right? And then it's, and just so much respect for the Medical Reserve Corps, because I volunteered for a lot of the clinics, and I remember seeing some of you, and just, seeing all the other events that you do as well. And, I know about the senior games, but it just never connected of like, this is what they're doing. So my question for you, Sue, right, is how can we, as the Board of Health, support you and help support this great program in our community?
Well, I would have to say just, we want to be before you, keep it in first and foremost. I think our leadership now at Thurston County Public Health is going to be that conduit to keep you informed of what's happening and the importance of it, and the value of it. We are hopefully building our staff capacity a little more with, I'm going to say, foundational public health specifically, that's going to help. And soon Daphne's position will be funded. So, all LHJs in Washington State would like to have an MRC, but there's a cost to it. And it can be difficult to stand up and start up. And especially during times where you're just doing training. It's really great when they have events and we bring everybody up and you see all that value and return on investment. So I think it's just keeping it in the forefront and giving our members an opportunity to help. We can't do everything. That's the caution that I have to be careful of, and Daphne's going to be. We can't do every single event. We have to be very selective. But I think it's continuing that strong commitment from leadership as well as executive leadership at the board as well as the county level, that the MRC, the mission of the MRC, is an important component of public health moving forward.
I agree. And one of the things that I remember about one of our yearly briefings was you were always prepared for something like this because of the trainings, right? And so while, when COVID-19 hit, the
Medical Resource Corps was ready to go just because of all those trainings that they'd had, and they were ready to kind of jump in. And so I think the trainings do add those value, because if there is another emergency again, they'll be ready to go again. And not sure how we could have done it without all of you. So just again, thank you so much for really stepping up and really helping us with. And Sue, thank you so much, Daphne.
And to staff as well.
You know, and I know that you're recognized statewide for all the work that you've done here in Thurston, and you know, you're such a great asset to Thurston County, and just want to recognize, you know, that we see the work that you're doing. So thank you.
Thank you very much. Much appreciated, and thanks to all of you.
Board Member Vasquez, and then I'll go to Board Member Edwards.
I just, it's really lovely to be able to hear about all the different kinds of work that you do as the Medical Reserve Corps. I definitely identify with the need to feel like you're doing something helpful, right? I had that same instinct when COVID happened. I volunteered with Department of Health in the incident management team, actually trying to find a way to coordinate volunteers, the non-medical volunteers, because we needed as many people as we could get to try to do something, like coordinating the scheduling of, at that time, testing before we had vaccines. So it's exciting to me to hear all the work that you do, because I don't have a ton of free time right now, but I think when my situation changes, I would love to be able to volunteer. I don't have a medical credential, but it sounds like you need people to do all kinds of stuff. So it's great to know that this resource exists in our community. Thank you for your work.
I guess I'd like to just say that the Medical Reserve Corps in total, all of the folks that oversee it with the county, but also the 100 and some people that participate, are just amazing. There's a lot of people that do a lot of good things, but I had a hard time listening to this presentation from these folks in the last few minutes. And my problem was, I couldn't hardly stay in my chair. I can't hardly, I mean, you folks don't get any recognition. And we have to, I wanted to get up and clap after each one. So I'm gonna ask the board to give you folks a hand, because this, it's amazing what you do on a daily basis. So thank you very much for everything you do.
Thank you. I came tonight with a question. I think I heard the answer, but I was curious how your numbers of volunteers changed pre-pandemic to post-pandemic. I think I heard it maybe it was a call to action, which surprised me a little.
So during the COVID-19 pandemic, we definitely had a huge increase in volunteers. And actually, we did have to send some over to United Way, the non-medical volunteers, because we had to focus on specifically medical volunteers to staff those or support those vaccination clinics and testing efforts. So during the initial months of the COVID pandemic, we onboarded 67 new volunteers. So huge increase in numbers, and we did see a little bit of a drop off after kind of the end of vaccinations, end of mass vaccination clinics, just because, you know, there was a little less engagement for our volunteers. But as you heard, several of our volunteers on our leadership team, actually over half of them, joined because of COVID or right around the time of COVID. So we had a lot of retainment there, but just trying to keep them involved and have activities. And, you know, the excitement of COVID is kind of over, but now seeing everything else that MRC can contribute to the community.
Where do your numbers sit now compared to pre-pandemic?
I apologize because I joined the team in the middle of the pandemic, so I'm not exactly sure, but I believe we had about, do we have 80?
Yeah, we fluctuated.
Yeah.
And H1N1 was a big fluctuation. And I came on in 2010, and I think we were up at over 200. So at one point we get up to 200, and anytime there's a response, and you know, we're gonna get that, and then you're gonna have people drop off. And keeping it around 100 is incredibly manageable, and the ability to go out and do a lot of different things, but be at the ready for a public health emergency for surge.
I'm going to echo a lot of what others have already said, but I also came out and did some of those vaccine clinics at South Puget Sound and experienced that, people crying in gratitude in their car. You know, it was just, I didn't do a lot of them because frankly, they're exhausting. So whether you guys did a handful or every weekend, thank you. And I represent school leadership and school nurses in my day job. And school, as you probably know, school teachers were among the first to be eligible for vaccines as well. Also very grateful. So thank you so much for your work there.
Thank you.
All right, thank you so much. Very good.
Thank you all.
Perfect. Thanks to everybody for coming. Okay, let's move on to item 6A, Washington chapter of the American Academy of Pediatrics update. And we have one of our own board members to present some information for us.
Yes. So thank you so much for readjusting and adding this to the agenda. Time-wise, it fits really well. And so we were given information, and I know David Bean has been shared with this as well, that there's a group of pediatricians who learned during the pandemic that partnering between schools, medical professionals, and local health jurisdictions was very valuable in basically attending to the needs of kids during the pandemic. And they thought perhaps moving forward that there would be ongoing use in that. And because sort of our vaccine rates, they brought the opportunity to us. And I would say that we certainly have, I think, really good people who could partner. And I think it would be really cool if Thurston County had the healthiest kids in the state. And I think that will both moving forward potentially change the community and where we spend our money. But simple things like this are not expensive to do. So the Washington Chapter AAP has funding to have some staff draw the group together and kind of get it rolling and support it for a year or so. And so then hopefully at that point, the relationships would be formed enough to be able to carry forward and continue meeting the needs of what we're seeing in the community as what the kids could really use. So I was looking on the dashboard, they just released kind of vaccine rate data again, and there definitely is work to be done. There are some school districts that clearly have figured out how to notify people when their kids are behind, and others who really could use more focus on that and support. Our state data, I think, may not be very accurate coming out of the pandemic because the management of reporting to that information system, immunization information system, is manual. And there's some upload, but to like keep who is still living in Thurston County, who's active and stuff, inactive versus active when we have a bunch of military families, I think it may be not quite accurate. And the data that the state has doesn't really necessarily match our internal data or the school data as well. And so working on that and really figuring out what really is our rate in the county, like are we vulnerable because our MMR rates are dipping low enough that we may be really vulnerable to a measles outbreak is very important to know. Potentially this work could also blend into other work. So, you know, whether you want to do parent education on a county level, that we offer opportunities throughout the county, or want to educate about fentanyl, or we want to work on mental health, or making sure we have healthy nutrition and activities in the county and people know how to access them, whatever that could be that impacts kids. I think you would have a blend of mission probably. So I don't know if you have any questions about it. We do have one of the people leading it lives in Thurston County, and so that would be an additional support too.
I have one question, and it's probably getting a little bit into the weeds. I understand that this isn't, the goal is to increase connection, maybe to increase, among other things, data and speed up how quickly we communicate when we have a problem. I recall seeing that Thurston County's pediatric vaccination rates are quite low. Do you think that that's partly a data problem and
I
that
think
that's
it's
not
partly,
necessarily
I think
reflective
it's
of true
part, I
immunization
think it's
rates.
under, like, I think the data undershows our rates. How low though? I don't know. And so that's what I want to know. So when you look at some of the school district data, I think Olympia school district data may be not great because there's about almost 10% out of compliance, which means either maybe they haven't been told that they are behind and had been given an opportunity to get back or not. And then, but their measles rate is a little bit potentially, something to follow. And, depending on what you look at as vaccinated might affect your data as well. Like, are you including flu vaccine? Are you including COVID vaccine? And so, I think that is good to understand, like, as a community, like
Even
what,
just shared definitions can improve data
yeah,
accuracy.
exactly.
Dr. Harvey, I'm wondering, right, with COVID, for example, and how much that kind of skewed our, the data, just because I know when COVID was happening, I had my youngest, but it was so hard to even get an appointment during that time with, it was only basically if it was an emergency at a time. And so my daughter got behind on it, right? And then there was an appointment. It was like, I think it was like 2-3 appointments where it was like vaccination appointments, basically. So did that have something to do maybe on our low and as
Yeah, I think
we're kind of,
I think what we need to know is, like, is this just COVID impact and we haven't caught up yet? Or has there been a shift in opinion about vaccines during that time that is something we can maybe help with? And how big is this problem really? But I think, I know for sure during the pandemic, when I partnered with schools and with public health, it actually was really helpful because both we were unifying what we figured out the problems were, especially when we talked mental health, because at one point that was really ridiculous to manage. And potentially, coming out of it, helping families with, like, maybe certain topics that we want to talk about, like maybe we need to talk about technology and kids, maybe we need to talk about, how to help support them in other ways, could be helpful.
Are you suggesting like a county-wide or even wider EHR system that we can all implement something else? Or what are you suggesting?
Well, there's a statewide immunization information system, but it is connected to a lot of the electronic health records and there's sort of uploading of data, but it's not managing who those patients are and where they live unless we sometimes manually go in and inactivate people. So let's say I have a military family that moves to Hawaii, they're still potentially in our data and they're not getting vaccinated here anymore and the data is not getting uploaded. And so some of that may impact the data a little bit. And so coming out of the pandemic, like our staff this summer, we're gonna have enough extra staff to just focus on that for a while and clean up our data. And so each of these clinics potentially are impacting that. And then the schools, like how strict are the schools being with checking every kid who's coming in, that they have everything they need and notifying them if they're missing something, like those things. Sometimes people don't even know their kid is behind and they're like, of course I'd go in if I knew that. And then I think the other thing we can figure out is, do we have an access to care problem? Like, is there a gap of people here that just don't have a place to go get a vaccine or don't have any medical provider or don't want a medical provider potentially? And, I think that might be helpful to know as well, that we're kind of meeting those needs. But.
So you've got a slide here with the model, it says model Lewis County, and you show who is meeting. Were they doing this data sharing, like exercise that you're kind of talking about?
So the one that they did in the pandemic was just on sort of reopening schools safely and that kind of stuff, but they found it was just very constructive. And so in our county, it could be whatever you would want it to be focused on potentially. But we thought vaccines might be a good place to start just because it does impact all of us pretty equally. And then whether it's superintendents or school nurses or other staff, I don't think anyone cares who these people are from these organizations, like whoever people think is the best person, like same thing for the county, like obviously Dr. A is awesome, David's awesome, but if they think other staff members are more appropriate, you guys have some awesome skilled, nurses who clearly understand the issues and the impact and could be, I think, good participants, so.
Could somebody who's got the, Jamie, could you put the people so I can see more of the people?
Sorry, I couldn't hear you.
Like, I just see Art's box up there. Can you change the view so there's like a strip of, I see more of the people that are still, yeah. And Dr. A, I wanted to maybe, David's hands up, so I'll start with Director Bain, and then Dr. A, I'm gonna ask you if you're familiar with any of these models or if you have any thoughts about it. Go ahead, David.
Yeah, thanks. And thanks, Dr. Harvey, for presenting this. This is an area, and I've been here about 6 months now, and as I kind of look at the future, what are the topics and areas we should focus on? Immunization keeps coming up as an area that we need to spend a lot of energy and time on as a county, and so this is like further proof to me of this is the direction we need to head in, so I really appreciate that. And actually, Commissioner Minter, you actually asked the question I was going to ask Dr. Harvey about kind of the Lewis County experience and kind of more details on that. One of the things I was interested in, Dr. Harvey, was it sounds like there are other counties that are also kind of being reached out to, and I didn't know. I always like seeing what other folks are kind of up to and their experience. So are there other examples of folks who are kind of starting this kind of partnership, and what's that been looking like? Because I'm really interested in sort of seeing that as well.
Yeah, I think they're reaching out to 10 in the hopes that if 10 will participate, they've got the staff time to support that. I know Skagit is for sure interested. Spokane, I believe, is interested. So we've been kind of trying to do like partly based on rates and then partly based on areas that we think might have the ability to do it. So I know for sure they've already met with, I think, 8 of them.
Okay, well, that's good to know. And sort of was the
We're back.
I was gonna say it must be 6 o'clock.
Yeah.
Was one of the ideas too for the participating counties to also work with each other as well, Dr. Harvey, or was it sort of just county by county?
Yeah, there definitely opportunity to do that peer-to-peer sharing and best practices or lessons learned, for sure.
Then my last question was just making sure so I'm kind of understanding the model well. I mean, the idea is to kind of sort of formalize a kind of ongoing sort of sharing of information and conversations between kind of the provider community and schools, public health, or like, I just want to make sure I'm understanding kind of the kind of end product, if you will, of the concept.
Yeah, I think the hope is that close relationships will be forged that are there to partner when things are needed. And so if over time we feel like, oh, things seem pretty good and we don't need to meet very often, but maybe like once a year or every 6 months, it certainly can go down to that. But I think schools and people who work with kids are thinking right now there's a lot we could work on to help with. The kids really struggled during the pandemic, and there's still a large chunk of them are still really struggling. And I think we have other things like impacts of climate change, or other things that potentially are going to impact the air quality. That's not going to be good for kids. I think there may be ways that it's really helpful to have sort of a unified way to communicate and make sure our messaging is very similar, and that we're all hearing that this seems to be a thing everyone in the community cares about right now. Let's see if we can help respond and support to that. I think that might be really helpful.
Thank you. I'm fortunate enough to work with school leadership and nurses in 5 counties, and I've watched these sort of groups of, specific to the pandemic, kind of organically create collaborations. The Lewis County one's a fine example of that. We also did something like that in Grace Harbor that was really successful. This to me looks like just an opportunity for Thurston County to formalize that, and without it having to happen organically, to formalize it and give it some structure and then let it run. And you're right, there are lots of issues that Department of Health and schools could work on in collaboration, and providers. And I would also just say, at least for my organization, I work at Capital Region ESD 113, we have staff that could be put on a project like this, and I'm sure some of you do as well. So totally support this.
Thank you, Board Member Nelson. And I know David's smiling right now because he knows exactly what I'm going to say. So actually, I got contacted by the Olympia School District, and they had me join a meeting with Grace Harbor School District and the Grace Harbor Public Health Director. And they talked about how they're doing health clinics in Grace Harbor, and Olympia School District was interested in doing that.
School-based health center model.
Yes, and so this week, when is it, David?
Thursday.
This Thursday, we're having a meeting. At 2 p.m. I'm not sure if you would be available to join us, and I can send you the link for that.
What is this?
Thursday at 2.
Who are you meeting?
With the Olympia School District and Director Bain, and just to try to get more information on what they're looking for and what a partnership like this would look like.
Okay, I would love to do that.
I'll send you the invite, yeah. Now that you said you have resources available, I'm just even more excited.
Dr. Abdul-Malik.
Thank you so much, Dr. Harvey, for sharing this information and this opportunity. I agree that during the pandemic, we saw the potential for partnerships, across many sectors, and honestly, coming together to work on these big county-wide and community-wide problems. Definitely, the more minds and lenses and scopes of expertise as we can bring together to serve the folks of Thurston County is a good thing. So I just wanted to say thank you for presenting this.
Anyone else? Good. Well, it sounds like we have the right people in the room to get something moving forward. And I don't know, what do you, Director Bain, is this something you could sort of maybe move forward in some way, maybe following your meeting with Commissioner Mejia and Olympia School District, and kind of go from there?
Yeah, this is definitely, like I said, I kind of led with, I'm really, really interested in our immunization work. I know there's a lot of pieces of that puzzle. So this fits nicely with kind of where my brain is heading and this kind of focus area. So I'd love to chat further, Dr. Harvey, and kind of sort of see kind of the potential for us and how we can best kind of navigate this. But I love the idea of being able to collaborate with the school systems, the providers. This is really exciting. I want to say post-COVID carefully, but as we move past the kind of emergency part of COVID, I think these partnerships we formed during COVID are just so key, and I don't want to lose those. So for me, this is like super exciting on multiple levels to sort of have that cross-sector collaboration, and want to make sure, of course, with Dr. A and our immunization team that we're kind of being strategic as a department, right? And sort of how we're approaching this as well. So I'm excited to kind of continue the conversation and to figure out kind of what are those nexus points. And of course, Commissioner Mejia, really interested in sort of the interest you've shown in sort of our work with the school systems more directly. So more to come on both those fronts.
Okay, yep.
One final comment. I just want to caution that school-based health centers and this kind of collaborative that Dr. Harvey's talking about have a little overlap, but they're two very distinct projects.
Yes.
Well, and if you partner with, one thing that would be a challenge is getting doctors to come right now, and finding new ones it's really hard. I have a new one coming and I'm really grateful. But potentially it could be like a medical reserve corps where you have all the providers in the community. We're able to rotate certain sites or support certain schools. I think we could be creative potentially if we can't find someone to hire to be a school-based person. And one thing we always don't want to do is undermine a medical home. So my clinic has built really hard work to build a medical home. So we have 3 therapists in it. We have a psychiatrist that consults on our kids. We have a community health worker. You know, like we don't want our kids potentially being diverted to a school clinic unless that's their choice, which that's great. But that's the question. Do we have an access to care issue? If we have access to care issue, that might be a great solution. So it's sort of that, we don't want to undermine what we have if we don't need the other, but if we need the other, we should probably figure out and build that out.
Do we have data on that? Whether or not there are families in our community that don't have access to care for their kids?
We don't have the data. I suspect there are, but I don't know that for a fact.
Okay, thank you. Let's go to our health officer's report. Dr. Abdulmalik, you're up.
Hi, good evening, everyone. I will be exceedingly brief this evening. First, I wanted to so in addition to my report, I also wanted to thank our Medical Reserve Corps for all of their amazing work throughout the COVID-19 pandemic. We were there like 7 days a week at the, in the beginning of the vaccine efforts. I know, a lot of the folks that you heard from, I have seen in rain, shine, multiple settings. And I just wanted to thank all of them for everything that they've contributed to the health of our community and everything that they continue to contribute. Both in terms of the events that they support, with first aid and in other ways, as well as kind of the emergency response piece, as well as our back to school IMSS clinics for folks. So just wanted to add my thanks to all of the thanks previously given. Talking a little bit about COVID in our community, we're at so the reporting metrics changed. We are now really following COVID-19 hospitalizations and utilization that way as to follow COVID in our community. Our hospitalizations remain low, so 0.9 hospitalizations per 100,000 over the past 7 days for the week ending 6/3, accounting for 1% of staffed inpatient beds being occupied by someone who tested positive for COVID, and 1.3% of ICU beds at this point in our county. We're not hearing, there's minimal influenza activity. We have had a bit of an uptick in acute gastroenteritis, especially in school-aged children. And when this happens, we give guidance around, folks staying home. So in non-outbreak settings or non-cluster settings, that's about 24 hours after the end of symptoms. In a cluster and outbreak, you're looking at staying home, 48 hours after ending of symptoms. And that's just because in that setting, there's evidence that there's a concern for ongoing transmission. And so there's a little bit of extra precaution there. We haven't, thankfully, we haven't seen any, so no cases of severe illness from gastroenteritis have yet been reported, which is good news. And we continue to support. The other thing that happens when we hear about clusters, especially in a facility, is we give cleaning guidance, which for the schools is old hat because OSPI guidance is extremely good. And we also kind of talk to food service folks just to make sure that folks are following all the right procedures and precautions. So whenever there's a bit of a cluster in terms of acute gastroenteritis, it's the multiple parts of our department come together to support the community. We do so while viral sources of gastroenteritis are more common earlier in the year, in summer, we're also, we can sometimes see an increase in diarrheal illness, as people have picnics, and there are other, bacterial causes of diarrhea as well. So just wanted to share that what we've seen, and also remind folks to keep food cold, and if something has been out in the sun too long, just to use extreme caution. It's much better to not eat that food than to get sick. I did also want to share a little bit about some of our work. We have so in this past month, we successfully had a child death review meeting. So this is important. This is important because it brings the whole community together, and our Bonnie Peterson and our NFP team really coordinate bringing folks from all over the community together to look at what happened in each of the selected cases, with the goal of seeing if there are recommendations or changes or things we can do as a community to prevent to prevent further deaths. So this is really important work. It's very, very hard work, and I definitely want to thank our NFP team for doing this essential work, as well as all of our community partners. So folks from the prosecuting attorney's office, CPS, our medics, school counselors, teachers, nurses, as well as other folks in our community. And I just want to thank everyone who's, coming together, both looking at, both the folks that are supporting, that are supporting our community every day, as well as, folks that come together when something very unfortunate happens, and, to look for possible solutions or possible ways that we can support each other better. And with that, I'm open to any questions you may have. Thank you so much, everyone.
Questions for Dr. A? Nope. Okay, thank you. Let's go. Let's let our director, David Bain, wrap things up. Any final comments, David?
Yeah, again, I am just really appreciative of the MRC team and the work that they did in this county and across the state, really, during the pandemic. And just appreciate the chance for folks to publicly thank them. It's a thankless job in many ways. So both that team and the rest of our COVID-19 team has really, I think, been above and beyond over the last couple of years. I actually wanted to I had one item, which was just for the chance for us to say thank you to Art Starry. This is his last Board of Health meeting, and he's been with us for 40 years. I believe he was in this role for, I think, was that 24 or 25, Art?
24.
24. And is someone who I have been super grateful to have learned from and to have been able to partner with, even in the short time I've been here. But beyond my time here, Art is a known legend in the state for environmental health, and is someone that I was looking forward to working with when I moved over here. So I just wanted a chance for myself to publicly say thank you to Art for everything he's done. I do not have enough words actually to express sort of my gratitude and the legacy he's going to leave behind. He's leaving behind a division that is well run. It's a division that is going to be successful when he leaves, because he's done such a good job of building it. And I'm just really grateful for everything from Art. And I wanted a chance for the board to give Art sort of his farewell at this board meeting as well.
Uh-oh.
Thank you, Art.
Commissioner Mejia.
I just want to say, Art, you have worked in this county longer than I have been alive, but
Uh-oh.
when
David first said that, I was like, oh, wow, right? But I think that just goes to your depth of knowledge and your dedication to Thurston County. I mean, coming in as a commissioner and going through the different presentations that you did and just your depth and knowledge in different environmental health issues it's definitely appreciated. And you're always looking to come up with solutions, and as times have changed, you've been very adaptive, and you are well known all across the state. And just we're definitely, well, I'm gonna miss you, and I'm gonna miss all the knowledge. And just thank you so much, really, for your service and your dedication to Thurston County. You have been such a great asset, really.
Well, thank you.
Are you joining MRC?
Yeah, that's what I was gonna ask. What are you gonna do with your spare time, Art?
Oh, we've got some vacation scheduled, but things like the MRC might be options too. I know that after I kind of do some projects and do some things, I'll be looking to probably find some new opportunities and probably look for an opportunity. Yeah, public health is, after doing it for 41 years, if you include Lewis County, it's going to be probably hard to get it out of my blood. So I'll look for opportunities and try to do some things to keep me busy and to hopefully better the community, do some stuff like that. I don't know what that is yet. Not the world's greatest planner when it comes to my personal stuff, but I'm sure they'll find something and try to stay engaged and try to help the community as best I can.
We have plenty of advisory boards and commissions that could use your expertise, Art. So
I'll look at those opportunities. I don't know that you want to see me that much. I think you probably need a break from me.
He's gonna serve on the Commissioner Mincer District 3 Advisory Board.
There we go.
I just want to thank you. You know how important the environmental health issues are to me, and so right from my first day in office, I've been calling on you for information, history, your expertise. You've always guided me in that regard, and I've been able to rely on your advice. And you came well recommended. Folks were telling me, former commissioners and other people who knew this county better than I did, encouraged me to reach out to you on key issues, and that's what I've tried to do. And I want you to thank you for all the help you've given me on these difficult issues.
Well, thank you, and you're welcome.
Yep. I would hope, Art, you don't unlist your phone number, because you've got a lot of institutional knowledge that we're not going to be able to make up. Yeah. That's the bottom line.
Absolutely.
Oh, don't worry, Commissioner, I've got it.
Yeah, all right. Okay, good. Well, the last thing I wanted to say is that we are not having a meeting in July, so make sure you mark your calendars that our next Board of Health meeting is August 8th. And Jen Freiheit's here, our new assistant director. Hi, Jen. Anything else for the good of the order before we adjourn?
Well, can I actually say a couple of things?
Yeah. Oh, absolutely.
Catch my breath. Give me a second. I do really appreciate all the maybe I'll catch this later, but I do appreciate the opportunities I've had. Both the leadership of the county and with our staff have been pretty fun. I'll time out, sorry. Go ahead.
All right. Thank you, Art.
Thank you. I did catch my breath here.
Okay. Oh, okay. Here we go.
Staff have been phenomenal. I appreciate. Oops, sorry. Am I back?
Yeah, you're back.
Yep.
Okay. For a minute, my computer was telling me that I wasn't speaking, or at least you couldn't hear me. But I do appreciate all the opportunities and whatever accolades I may get, they really belong with our board. I mean, with our actually with the board and with the staff. I mean, we've done phenomenal things. And the staff do all the work. At least as far as being the director, I've always felt like my job was to kind of give them the resources and the leadership and the guidance they need to do it. And I've done some of that. but I think they really deserve the credit for the things that have been accomplished. And I appreciate the opportunity to work with them and to work with you and to work with the community to do those things. So thank you.
Well, thank you.
Thanks, Art.
All right, well, on that bittersweet note, we're adjourned. Thank you, everybody.
Thank you.